Welcome to the Lighting Your Way podcast. This season, our sixth, we're talking to my colleagues at Guardian Nurses about how they help our patients navigate a very complex and confusing healthcare maze. At the end of each episode, you'll hear their suggestion as to how you can become an advocate for yourself and your loved ones. For a patient, there are plenty of challenges in the healthcare system, but perhaps none more frustrating than having a diagnostic test, treatment, or surgery denied by your health insurance company. Some studies suggest that insurers deny between 10 to 20% of the claims they receive. Honestly, sometimes it feels higher. And when less than 1% of patients appeal those denials, it's money that the insurers keep. After all, it can take energy and time, and a lot of patients just give up. After all, they're not feeling well. In this episode, I talk with Suzy Parker, my Guardian Nurses colleague, who in her role as a mobile care coordinator nurse for a health and welfare fund in Washington State, supports patients who have received denials. Suzy shares her suggestions for gearing up for an appeal. Warning, it's not easy. Suzy Parker, welcome to the podcast.
Thanks, Betty. I'm happy to be here.
Thank you. One of our West Coast nurses in Seattle, and you are working as a solo mobile care coordinator on one of our building trades programs. And you're a busy gal. You got a lot of folks to support, but one of the things I think is unique in your role is that you are often dealing with insurance-related questions, not just clinical questions. So tell us a little bit about how that evolved.
Okay, thanks, Betty. I started having members and their dependents call me directly when they had surgeries that were denied. And most of the time I was able to find out that the surgeries were wrongfully denied.
And what was, was there a theme? Was there a particular surgery that was being denied?
Yes, mostly spine surgeries, neck and low back, cervical and lumbar spine. And what happens is, and this is actually, I think, more common than people think, the insurance company, which is a very large, major company in the U.S., and I think probably all insurance companies are like this. They send you a letter of denial and they say you were denied because, and then they list a whole bunch of things. It can be diagnostic, physical therapy, chiropractic. There's about 10 things that go in there, and they don't tell you exactly what it is. You almost have to guess. Of course. It's all designed that way. We know that.
Right.
And so what I found is most of the time, the denial in that list of things is physical therapy. And physical therapy was not recommended by their surgeons because it will, one, cause more pain, and they're already in quite a bit of pain. And number two, it could make the injury worse. Right. So oftentimes those reasons that, the rationale for not moving forward with the patient with physical therapy is because of the damage and the pain it will cause. And oftentimes, Betty, that's not documented in the patient record.
So when folks came to you to ask, for help, how did you dig in? What was your process?
Oh, well, my process is I get all the information, of course, who's the surgeon. And then I get a HIPAA signed and I gather the notes. I'm particularly interested in the denial letter, so I can see, why was this denied? And of course, it's kind of a menu of
Right.
the
Pick one.
reasons. Yeah. And so typically so I talk to the patient, like, have you done this? Have you done this? And it's really most of the time physical therapy. And most people don't realize it because this letter is kind of overwhelming,
Right.
to most people.
Yeah.
So
And does the doctor does the surgeon's office get involved? Are they helpful to you when you're doing this
they
investigation?
are. So I fax the HIPAA and I get records. And I also say, um, because they too get the denial letter in their office.
Mhm.
And that's added to the patient's chart. And so, in my fax request, I say, you know, the patient says physical therapy was not done. And could you please address that and
Okay.
send me a document speaking to that? Because we're moving forward with an appeal.
So
And
if
I always get it.
no, if patients, so if you connect with a surgeon and say, hey, can you just document why you didn't recommend physical therapy? Is that often enough to turn the appeal into an approval or denial
Yes.
into an approval? Oh,
Yeah. That's
okay.
that's the number one thing that I have found in my experience. The number one reason why it's denied.
Wow. That's it's kind of like a secret. You're It's like a
I
little
think
secret.
I think they have many,
Yeah,
but
yeah. It's the behind the closed door, right? The wizard.
yeah, I
Um,
think it's much
s-
easier than people think it is
so
to
yeah, I
get
remember a
it
case,
overturned.
I guess a couple of years ago. We had a patient who had cervical issues, and to your point, right, doing physical therapy may have done more damage than just having the surgery. So to your point, it was pointed out, hey, this is kind of a scary thing. We don't want to recommend that. And
Mhm.
it took a little while, but the insurance company did finally approve it. Um,
Yeah.
are there other
Well,
cases that you get involved with? Like, I mean, I know there's these building trades guys, so they're probably going to have musculoskeletal issues and backs and hips and knees. Any other cases that come to mind for you?
there are, but first I wanted to tell you a little story about one of my patients who needed lumbar surgery. He'd been waiting for a while because when we do the appeals with the healthcare trust, it's quarterly. So we get all the paperwork in and wait for that date to come up for his appeal. And in the meantime, this poor man had to be hospitalized in an emergent way because he had a GI bleed. And the
Oh,
reason he had a GI bleed is because he was taking a lot of
right.
ibuprofen,
Yeah.
anti-inflammatories. And I mean, so, as you being a nurse, so many things could have gone south on this man. And so that was another thing, of course, the insurance company had to pay for was a GI bleed. And so
Wow.
then, obviously he couldn't take that anymore for pain. And so that's the story I wanted to tell you about
Wow.
one of my patients. He had a secondary problem. So that's the other thing I think about in the back of my head now is what could possibly happen if we don't do
Right.
appeal?
Right.
What are the outliers here? So I think that's an important takeaway.
No, it is. Are these guys still working? Are they working through this pain? Or are they on a disability?
Um, Most of them are not, and typically, the members that I work with, they're hard workers. They have a very high tolerance for pain, and
Mm-hmm. Yeah.
so when they absolutely can't work, it's a big deal,
Right.
obviously. But it tells me a lot when they aren't able to work because they work through a lot of pain
Right.
daily.
Right.
So,
Yeah.
yeah.
I mean, the musculoskeletal issues, I'm sure, are huge in the
Hmm.
trust. Um,
Hmm.
now, you had mentioned another case about an insurance company saying that something was cosmetic. Tell me about that story.
Yes. So I have a wonderful young lady who came to me again. It was a direct call to me, and she has a severe underbite, meaning her upper jaw is her lower jaw, I should say it this way, juts out.
Mhm.
So that she was born that way, and it's gotten progressively worse over the years. She's always been told and denied she needs maxillofacial surgery, and orthodontia goes along with that. So she's been told her whole life that this is cosmetic. So she was
Oh,
denied
geez.
several times. Her mother took her when she was a child, and so she grew up thinking this is the way it is. She's
Oh,
had many problems as a result of um, there are only two teeth molars on either side, upper and lower, that actually touch. So
wow.
her ability to chew is very impaired. She's limited in what she eats. If she, um, you know, does not chew or masticate, is the other word, the food enough, then it causes
Right.
discomfort in her GI system. Um, she has had cracked teeth over the years. So she called me
Mm.
and said, I don't know if this can be done, but this was denied. They say that it's cosmetic. And I met with her and at a coffee shop. And the minute I met with her, I knew there's no way this is cosmetic. This is
Right,
a
exactly. Right.
horrible physical problem, you know.
Well,
Um,
to your point earlier about what could go wrong, right? They're not looking downfield, right?
right.
Yeah. Go ahead.
And when I went with her to her surgeon's office, her maxillofacial surgeon, um, I got records, and um, that's one of the questions I asked him is, um, okay, looking in the future downfield, what could happen to this patient if nothing is done? And
Right.
eventually, he's surprised that she's been able to keep all her teeth this long. So
Jeez.
he said eventually all the teeth would go and she'd end up with dentures.
Oh,
But she would continue to have problems, um, throughout because of the jaw malformation she was born with. Um, so what I did was I got all the records and all the x-rays, and I got records from her orthodontist too, because they're working in tandem, the orthodontist and the maxillofacial surgeon.
hmm.
And we filed an
Thank God.
appeal. Yes, we filed an appeal. And, you know, the great thing is that the trust, the members of the board, the appeals committee, have hearts. They have really good
Are you
hearts.
saying, excuse me, Nurse Parker, are you saying that perhaps an insurance company doesn't? Is that what you're implying?
That's exactly what I'm saying. Because the same things were submitted to the insurance company. I mean, it's really a no-brainer that
Okay.
this is definitely not cosmetic.
Right.
It's a congenital anomaly. So, um, yes, and the cool thing is, and I've never had a doctor request to do this, was he wanted to testify on her behalf by phone.
Cool.
So he went first. The board I faxed, I got all the records to them for the meeting. And so they had everything in front of them, the x-rays, the photos, which is, it's very, very telling. And,
Hmm.
one of them was trying not to cry because this was such a disservice to this woman.
Was she there
So
at the hearing, or was
she
just
was.
photos?
She
She was?
was.
Oh,
Yeah,
wow.
and
Okay.
I hugged her. Now, um, when they're my patients in the appeal, I'm not allowed to ask questions.
Mm.
I can do the discussion, the deliberation part after the testimony's over because it's a legal proceeding. Um, so I had to, I kept my mouth shut. I was quiet, and then when I hugged her when she left, and it was hard for me not to. I was fighting tears, you
Yeah.
know. So yes, that was overwhelmingly won. We won that appeal for sure.
Whew. And did she have the surgery yet?
Not yet, because her orthodontia, they're, you know, so she has adjustments every 6 weeks,
Oh,
and they're getting the teeth ready for the surgery. So everything primarily has to be done, not everything, but the major movement of the teeth, because you're moving the roots too, have to be done prior to the surgery,
wow.
which is it's a pretty big surgery. I mean, you're
Yeah.
breaking the mandible, the jaw, and readjusting it, and she'll have hardware in there, and
Wow.
everything's going to be wired shut for a while, but she will be fixed. So
Wow.
yeah,
Congratulations, Suzy. That's great. I mean,
thanks, Betty.
I am sure, I'm positive that nobody's going to hug somebody after an appeal hearing. Did they make that decision right away? Did she leave knowing that it was approved, or was it soon
Well,
after?
the way they do it, Betty, is they tell, after the recording's off, then the attorney lets each person know that's appealing. There will be a decision in writing.
Mm,
They will receive within 7 days.
okay.
And so I, of course, stay after. And, so I had two patients that day,
Mm,
and they both won their appeals. And so, I told them beforehand, I'll text you after the vote. You don't have to wait 7 days. So,
okay. Insider information.
yeah, yeah. So as soon as they
Wow.
voted, I let them know. When I had a break, I stepped away and let them know that they won.
It's gotta be. It's gotta be so frustrating. I know that the speed at which insurance companies, departments and their communication is so slow, right? And to think that this woman's been dealing with this for so many years, it's so frustrating to have to wait. So I'm glad that you were able to give her that information before 7 days at
Yeah,
least.
yeah, thank you. I mean, I think that they were gonna move forward, her and her husband, with the surgery and everything anyway, but the amount of money is, with
How
the
much would something
surgery,
li Yeah, how much would something like that cost, do you know?
it's gonna say probably roughly 30,000, including the surgery.
Oh, yeah, it's a
It's
lot of
gotta be
money,
at
but
least that.
think about it. She'll be whole again, right? Which is the point, right? She's not gonna
Yeah,
be, and to your point earlier again, it may, down the road, prevent a lot of other slew of issues with her
it will
gastrointestinal
it
tract.
it will prevent. It absolutely
Yeah.
will. I just believe in doing the right thing, and that's where, when it comes across, my desk, my job, um, I'm a fierce advocate, and I'm proud of that. I like to think of myself as a pit bull with a rag doll or something that will not let go until she's absolutely sure she's won. And I really believe strongly in holding insurance companies accountable for the bad decisions, denials they sometimes make. It's really important
Go,
to me.
Susie, go. I say, good for you. That's,
Thank you.
it's empowering to be to have this kind of role where you're able to make that impact to patients,
It
directly,
is.
right?
It
Besides
is.
clinically supporting them, getting them
It,
to a doctor, getting to a better cancer treatment center. You have the ability to make things right. So
yeah,
kudos.
it's literally changing their lives.
Yeah.
And in my day-to-day work and helping people with appeals coming up, I mean, I don't lose sight of it, but there's so much going on in our work days, my work day, that when the appeal is won is when I get the full-on realization that, wow, I just help make a huge difference in this person's life. That's very important, that they deserve,
Yes, you did.
you know.
Right.
So I help wrong a right. I mean, right a wrong.
Ta-da!
Right or wrong.
So, Suze, with all of the experiences that you've had in the last few years, at least here at Guardian Nurses, when you think about advising someone that doesn't have a Nurse Parker, a fierce pit bull with a rag doll, throwing it back and forth, what do you suggest to our listeners who might want to take on an insurance decision, an appeal, to appeal something that's been denied?
Mhm. Yes. What I would say is, excuse me, first off, try to have an advocate, family member, close friend. If you know a nurse or someone in the medical field, great. And, have somebody else, is my hope that people will do, walk with you through this journey to read the denial letter, decipher what it says, ask questions of the doctor, the surgeon, what, show it to them. What did we miss here? Like, because again, they don't specifically tell you this is why we denied it. I mean, they would have a ton of appeals if they specifically told people. So get your doctor to help you decipher what it is in that list that wasn't done.
Okay.
And then, read because they will tell you in that letter towards the end, if you want to appeal, follow these instructions.
Okay.
So follow those instructions. I know there's a window of time you have to appeal it. It's, I think 30 to 60 days for most insurance companies. Get the documents that you need. Oftentimes, some insurances will do an appeal or a doc-to-doc talk. So the doctor treating the patient will have a virtual or phone meeting with one of the doctors that works for the insurance company. And a lot of times that will work. It just depends on, each insurance company has their own rules and way of doing things. So depending on what their process is, just follow the information to appeal it that's in the denial letter, but have a friend or a loved one, someone that can advocate for you, and get the records that you need from your doctor. Or if it's something like physical therapy, for example, that was missed, ask your doctor to send that in too. But don't give up. If you're fairly certain that this was wrongfully denied, then please don't give up and fight for it.
And if I might say in closing, if you get frustrated, call Guardian Nurses.
Perfect.
Yeah,
I 100% agree.
Yeah, I think sometimes it can be overwhelming, particularly if you're not feeling that well. So thank you, Suzy, for your advice and for your good work out there in Seattle. We really appreciate it, and I know your fund and the members appreciate it. So good job.
Thanks, Betty. I'm happy to be here. I appreciate it.
All right, talk to you soon. Thank you.
Okay. Thanks, Betty.
Thank you for joining us this week. You can find the Lighting Your Way podcast on Apple Podcasts, Google, YouTube, Spotify, and Stitcher. If you liked what you heard, tell a friend and leave us a review. You can learn all about Guardian Nurses Healthcare Advocates on our website, guardiannurses.com. So until next time, find some joy in the holiday season, pet all the good doggies and kitties, and remember to tell your people that you love them. Happy holidays.